Welcome to Monday's edition of COVID-19. We're starting the work week with the daily tally at above 1,000. And while authorities here are seeking to tighten social restrictions, their counterparts over in England are looking to ease their containment efforts. We have more during our studio session later on in the programme. Here first is the broader pandemic coverage with our Kwon Soa. Now, Soa, let's begin here on the local front then.
Sure, Sunny. We're seeing the highest confirmation of Sunday cases, which means the numbers accumulated as of 12 a.m. on Monday since the pandemic broke out in Korea. 1,252 cases were reported, and also over 1,200 of those are domestic transmissions. And we had over 1,400 cases on both Saturday and Sunday. And for the 13th consecutive day, infections have been at above 1,000. And if we compare the figures of Monday in the past weeks, we are seeing a clear incline of COVID-19 cases. And with that, the total number of infections in Korea is closely approaching 180,000. And the proportion of cases outside the metropolitan region has also been on the rise, now at 32.9%. This is the highest proportion for this region since the fourth wave of the virus here in the country. So let's take a closer look at the regional outbreaks here. The capital Seoul and Gyeonggi-do province in the triple digits with over 400 and 300 infections, but also concerns here in Daejeon with over 80 cases, and down here Gyeongsangnam-do province and Busan at between 60 and 80 cases in these regions. So the government decided to extend the ban on private gatherings of 5 or more people to outside the metropolitan region beginning today until August 1st to prevent confusion among people traveling to other places due to the summer vacation and also due to the severe situation.
1 week has passed since we enforced the highest social distancing level in the metropolitan region, but the number of infections has not declined. We need antivirus measures that work faster than the speed of the virus spreading.
And in combination with a ban on private gatherings, some places have also decided to raise their own social distancing measures, such as Gangneung-hee in Gangwon-do province to level 4 and also Jeju Island to level 3.
I see. Meanwhile, so there is also much alarm over the outbreak at a Korean naval unit.
Right, Sunny. More test results have come out from the Cheonghae unit that's on an anti-pirate mission off the waters of Africa. At least 247 people have tested positive out of some 301 personnel. That's more than 80%. Now, help is on its way, and the entire crew will be airlifted and is expected to return to Korea on Tuesday. Now, back on land this Monday, Korea is for the first time inoculating its teenagers for COVID-19. High school seniors and high school instructors will be subject to Pfizer doses, and also reservation will kick off for people aged 53 and 54, while those aged between 50 and 52 can make their bookings beginning on Tuesday. And so far, Korea has over 16 million people who got at least one dose of COVID-19 vaccination. Let's also take a look at the international updates. We have now surpassed 191 million cases of COVID-19. And while global cases are showing no clear signs of abating, England is ending its lockdown as planned on Monday local time, while daily COVID-19 infections have recently risen to the 50,000s in the UK, with those cases feared to double once restrictions are loosened. Italy is observing resurgences among the younger population in particular, with over 3,000 cases in recent days, with Euro 2020 parades seen as one of the major reasons. And an upcoming sports event, the Tokyo Olympics, is also causing more and more worries, as for the first time, 2 athletes tested positive in the Olympic Village. It is not revealed who they are. And now let's take a look at the numbers with the major outbreaks. Let's take a look at the UK and Italy that we just mentioned. The UK has, as of noon Korea time in the past 24 hours, has less than 50,000 infections, a slight decline, while Italy saw over 3,100 new infections. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, up next, here's a tangible finding in support of face masks amid the spread of COVID-19. Research proves the initial infection point of the coronavirus is the nose. Do take a look.
A group of Korean researchers came under the media spotlight recently for their study on how the coronavirus is transmitted. The studies show that the virus infects unsuspecting victims primarily by targeting their nasal cavity. The team found that cilia, the hair-like structures that line the nasal passageway, is where the first infection and replication of the coronavirus takes place.
선모상피세포는 이러한 호흡기 점막 표면에 위치하고 있는 선모가 달려있는 세포인데요. 이런 선모 달려있는 세포들이 원래는 이물질을 이렇게 제거를 하고 콧물과 함께 제거를 하는 역할을 하게 되는데 저희가 이제 연구를 통해서 이런 코로나 바이러스들이 이런 선모상피세포에 있는 특정한 단백질을 통해서 우리 몸의 세포 안에 들어온다. 이런 사실을 밝혀내서 이런 것들이 코로나 바이러스가 감염과 증시에 1차적인 표적이 된다는 사실을 명확하게 밝혀내었습니다.
Other experts had previously hinted at the possibility of COVID-19 transmissions through the eyes and nose. If the findings of the study are true and the nasal cavity is the primary vector of the virus, does that necessarily exclude the eyes as a possible source of infection?
눈도 이제 눈물길을 통해서 코와 직접적으로 연결이 되어 있고요. 그래서 따라서 눈물과 함께 코점막으로 도달할 수도 있고 입도 당연하지만 코와 기관지가 다 서로 연결됐기 때문에 당연히 입을 통해 감염될 수 있습니다. 입에 있는 조직에 감염되지 않는다는 뜻이지 입을 통해 감염되지 않는다는 뜻은 아니니까요.
People often deal with any nasal discomforts by either picking or blowing their nose. So would that elevate your risk of being infected with the coronavirus?
So to me, the greatest threat for COVID with nose picking is probably less to do with the finger and more to do with removing our mask when we are around other people. Can you catch it from finger to nose? Yes, you can. If you touch an infectious particle with your hand and then immediately touch your nose with your finger to pick the nose, that can happen. Regardless of how you get the crusts out, very important to wash hands with soap and water carefully, or to use an alcohol-based hand rub if soap and water is not available.
New COVID-19 vaccines that are delivered through the use of a nasal spray instead of syringes are now under development.
비강에 분무하는 백신은 현재까지 사용되는 것은 없고요. 그렇지만 이제 코로 아무래도 투입했을 때 효과가 더 늘어날 수 있다라는 과학적인 원리가 존재하기 때문에 우리가 접종하는 것 말고도 분무형 스프레이 백신에 대한 개발이 시도가 되고 있는데요.
According to the WHO, as of July, there are a total of 292 different COVID-19 vaccines that are under development worldwide, with 8 of them employing nasal sprays.
There is a long history of people developing intranasal vaccines, and indeed there are effective vaccines against flu which are delivered as nasal sprays. So that's also been an important avenue to explore. And we know that the immune system has a memory of where it encounters a virus or a vaccine in your body. So if it encounters something in your nose, it will produce an immune response that's particularly good at defending against things in your nose as well. So for that reason, we think an intranasal spray might be more effective than an injected vaccine.
These latest findings on the vulnerability of our noses to the risk of transmission have once again underscored the importance of proper masking and hand hygiene as the key to prevention.
It's time now for the regular afternoon briefing on the COVID-19 situation here in the local front for this Monday. Now, as we mentioned earlier, the cap on social gatherings has been extended to regions outside of the Greater Seoul area. So starting today, that is Monday, until the 1st of August, only 4 people can meet up in these regions, regardless of their level of social restrictions. And speaking of those restrictions, up on the screen now is a map showing the different levels of social distancing across the country. Level 4 has been announced in the Greater Seoul area and in the city of Gangneung, which has been noting an influx of summer holidaymakers. Now, this is also the reality over in the southern resort island of Jeju, where authorities have imposed Level 3 measures. Most other regions are under level 2 and 1, but do remember the limit on the number of people who can gather for social purposes stands at 4 nationwide, and that number goes down to 2 people in regions at level 4 after 6 in the evening. On the screen also now are the specific places, their level of social restrictions and duration. Places including Sejong, Gyeongsang-Bukdo Province and parts of Jeollabuk-do Province are under level 1. Most other places such as Daejeon, the Chungcheong-do provinces and Jeollanam-do Province as well as Gyeongsang-Namdo Province are under level 2. The Southern Resort Island, as mentioned earlier, is under level 3. Meanwhile, the metropolitan region and Gangneung City in Gangwon-do Province are under level 4. We are still waiting for the briefing to start, so let's now take a look at the broader government framework on social distancing guidelines. The new framework includes a 4-tier arrangement. Level 1 refers to scattered daily infections, meaning fewer than 500 daily cases across the nation that are within medical capacity. Accordingly, the response involves individual compliance with simple basic efforts to curb transmission. Level 2 refers to cluster infections within the community, standing at over 500 daily infections, but fewer than 1,000 nationwide. And the response involves limits on the number of people at both indoor and outdoor venues. Level 3 refers to larger regional infections that would be more than 1,000, but fewer than 4,000 on a daily basis nationwide. And the response involves a ban on large gatherings. Finally, level 4 refers to a nationwide outbreak of over 4,000 daily cases, and the response involves the imposing of a stay-at-home order. Now, for the specifics with regard to gatherings, under level 1, there are no limits on the number of people meeting for social purposes, while events with 500 or more people simply require prior registration with local authorities, and rallies can host up to 499 participants. Under level 2, social gatherings of up to 8 people are allowed, while events such as weddings and rallies can host a total of 99 people. Under level 3, social gatherings can only involve up to 4 people, while events face a 49 people cap, as do rallies. Under level 4, which is the case here in the Greater Seoul area, only 2 people can gather outdoors if a stay-at-home order has yet to be fully imposed, while all events are banned and only one-person protest permitted. But do remember, here in the Greater Seoul area, up to 4 people are allowed to meet until 6 p.m. in the evening. Moving on to guidelines at places of work and worship. Under level 1, workplaces, regardless of their size, are encouraged to adopt a working arrangement that allows workers a blend of online and offline options, while places of worship can host 50% of their capacity. Under level 2, workplaces with 300 more workers will be asked to have 10% of their workforce working from home. Now, the exception is the manufacturing industry, while places of worship can host 30% of their capacity. Under level 3, workplaces with 50 and more workers will be asked to have 20% of their workforce working from home. Again, the exception is the manufacturing industry, while places of worship can host 20% of their capacity. Under level 4, workplaces will be asked to have 30% of their workforce working from home, regardless of their size. The manufacturing industry, again, will be an exception, while places of worship can only hold virtual sermons. Meanwhile, at multi-use venues under level 1, basic prevention measures are encouraged with no restrictions on business hours. Under level 2, venues will be asked to limit their patrons to 50% of their seating capacity. Also, restaurants, cafes and entertainment facilities will close doors at midnight, and local authorities will be permitted, that is, to allow for exceptions depending on their local daily tallies. The briefing's about to start. We'll come back to you afterwards.
Good afternoon, ladies and gentlemen. I am Commissioner Chung Eun-kyung of the KDCA, and let us now begin our regular briefing for July 19th. First, on the vaccination front, as of today midnight, we have a total of 16 million and over 16 million who have been received at least one dose, and this stands for about 31.4% of the total population. And we also have about 6.5 million people who have been fully fully vaccinated, accounting for 12.8% of the population. And also in their age group of 60, we have about 83% completing their vaccination. And also this similar vaccination rate for those in the ages of 70 and 80. And as for July, we have about 84% of the eligible recipients who have completed the booking. And as of last week, we also have the caregivers and also the teachers completing the booking process by 93.5%. And about 79% of those between the ages of 55 and 59 have completed their booking process. And as for high school seniors and faculty members, we also have in line with our goal of processing with the safe college entrance exam, we are also starting the vaccination for about 650,000 people who are high school seniors and faculty members. And we also have many high schools who are also going to carry out these vaccinations. And about 460,000 of them are high school seniors, and they will be receiving their vaccines, the Pfizer vaccines, at about 2,000 vaccination centers around the country. And we have been giving out related data to the parents of the students, and we are preparing for possible adverse responses. And right now, as for the Pfizer vaccine, we are preparing for a possible anaphylaxis response. And on top of this, we are also looking for any heart inflammations like myocarditis and so forth. And all of the vaccination recipients, in order to prevent the possible occurrence of anaphylaxis, we ask you to stay at the vaccination centers for the next 15 to 30 minutes to watch your conditions. And even after returning home, please monitor your conditions very closely for the next 3 hours. And in relation to any heart inflammations, for the next 1 week or so, we ask you to refrain from engaging in intense physical workouts. And also, at least 3 days after inoculation, we ask you to also take particular notice of any kinds of symptoms like fever or other kind of symptoms. We ask you to go to the doctor as soon as possible if you show such symptoms. And as for the faculty members and teachers, we ask you to be trained of any responses to possible adverse responses so that you could provide support and assistance to any students who are experiencing possible adverse responses after inoculation. And we also ask for the vaccination centers personnel to also prevent any possible severe reactions, including the occurrence of anaphylaxis. And at hospitals, if you have any suspected cases of heart inflammation or other related adverse responses, we ask you to report to us immediately. And as for those between the age of 50 and 54, we also are carrying out our advanced booking for the vaccination. And here are some details. Starting from today, 8 p.m., we will be receiving the booking for the next 6 days. And this includes those between the ages of 50 and 54. And they will be opened on a consecutive order. And we are also having dispersed dates to also increase the accessibility. And as for those, the ages between the 53 and 54, they will be the first group to be able to book their vaccination appointments. And also starting from the 20th of July, we will be also receiving the booking for all of the people between the ages of 50 and 54. And after the 21st of July, that is, and this will be carried out until 24th. And we also would like to note that immediately after the vaccination reservation opens, we are also very much concerned of a possible congestion of the connections. So we ask you to disperse and utilize other time periods to make your booking for the vaccine appointments. And as for the vaccine supply, we are having a flexible schedule right now. And in order to ensure a safe environment for the bookings, for the vaccination that is, we are also utilizing Moderna and Pfizer vaccines to those aged over the age of 50. And in August and July, we also have Moderna vaccines to arrive. and we have no changes in the total doses that are set to schedule. Nevertheless, we are also seeing that the Moderna vaccines will be focused on the last week of July, and to this end, we saw the need to have a flexible response to the approval of the arrival, that is, of the Moderna vaccines. And to this end, we also are going to utilize the same type of mRNA vaccine, which is the Pfizer vaccine. And also, moreover, we would like to ask for your consideration and understanding, because we have to sometimes switch your vaccine type, which will be different from those that you have made your reservations. And as for the details, we will be giving out individual notices. And right now, we also have an automatic notice of the schedule for the second dose if you receive your first dose. And this is just a tentative schedule. And as for the confirmed second dose schedule, we will be giving out individual notices in the time being. And as for the adverse responses, here are some updates and our analysis. And as of 18th midnight, we have a total of more than 100,000 cases of the reports done. And we also have about 0.04% of the report rate. And most of them, about 94%, are simple and moderate and light symptoms. And we also have about 5.5% of severe symptoms like anaphylaxis. And as for the cross-inoculation, this includes the people who have received AstraZeneca for their first dose, and also the Pfizer vaccine for the second dose. We have a total of 60,000 cases of inoculation, and we also have about 0.18% of the adverse responsive reports from this group of people. We see that major of these cases were mild and common symptoms, and 0 cases of death have been reported so far. And also, compared to the adverse responses when you receive the same type of vaccines, there is no big difference. And because we are also right now rolling out these cross-inoculations as well, we need to provide you details after we give out a significant number of these vaccinations. And according to the WHO and also European Medical Association, we are also notifying the people that you could also be prone to a possible heart inflammation after receiving the mRNA vaccines. And most of them, when we see the cases in Europe, they are also common in the younger age group, and especially among male. And also after the second dose, it was more frequently reported than the first dose. And after inoculation, if you feel any difficulties in breathing or chest pain, or also the heavy beating of your heart, or any other suspected symptoms of heart inflammation, we ask you to visit a doctor as soon as possible. And as for these hospitals who have seen such patients, we ask you to tell us as soon as possible. And here are also updates on the screening of the damage compensation team, who have met for the 22nd time right now. And they have been looking at about 800 cases of death, and also more cases of anaphylaxis as well. And as for the 135 cases, they have confirmed the correlation with the vaccines. And this includes one more case of death and 8 more cases of anaphylaxis, raising the total to 135. And also, during the latest the 22nd meeting, we have seen 3 of the re-evaluation cases, and also conducted the cases analysis for 18 suspected cases of anaphylaxis. And as for the major sources of these deaths, we have been looking at these comprehensive analysis, and of them, 100 cases have been deemed not to have any correlation with the vaccine, while 4 are still pending after further analysis and investigation. And a majority of these cases were related to myocarditis or other symptoms, and also they were also due to other underlying medical illnesses, including also diabetes and high blood pressure. Nevertheless, after 9 days of anaphylaxis, we have the Guillain-Barré syndrome. And as for this specific case, we have deemed to have no sufficient amount of evidence right now. And as for the 8 new anaphylaxis cases, we have seen the correlation with the COVID-19 vaccine. And here are our weekly analysis of the COVID-19 outbreak here in the country. During the past week, we have seen 1,348 average daily domestic cases, and compared to the previous week, this is about 35.9% on-week increase. And compared to the previous week, we have seen a large spread of the virus in the non-metropolitan area. And also in the metropolitan area, we have seen the domestic daily surge from 799 to about 990, accounting for about 84% of the total cases. And also in non-metropolitan area, we also see a rapid surge from 193 to about 300, and the proportion has increased to over 26%. And imported cases, we also have about 40 cases, which is a slight decline from the previous week. And as for the critically ill patients, we also have 159 cases. This is on a steady rise. And we also have seen 11 COVID-19 related deaths during the past week, and the fatality rate seems to be on a downward trend. And during the past 4 weeks, we have seen the sources of infection, and we have seen the increase of the proportion of the contact with the previous cases. And at multi-use facilities, including clubs and bars, restaurants, and military training centers and cram schools, we are seeing resurgence of the virus as well. And at hospitals and also places of the workplaces, including the manufacturing industries, we are also seeing cluster infections as well. And major risk factor is the not appropriate wearing of the face mask, and also the lack of social distancing measures, and also ventilations. And by age group, we have seen all of the age group except for those over the age of 80 seen a decline in the cases. And also by age group, those in the 20s, we have the highest proportion, standing at 0.5 out of every 100,000 people. And also we have seen a large increase in the proportion between the age group of teens and also to their 40s. And out of the imported cases here in South Korea, we also have 47.1% of who have been tested with the new variants. We have seen a slight increase in this on week. And as for the Delta variant, we have seen a 10.4% on week rise, standing at about 34% for the past week. And lately, we are seeing an increase, a stagnant increase in the number of cases in the metropolitan area thanks to our strict restrictions. However, we are seeing a 1,000 caseload on a daily basis, and we believe that the non-metropolitan area is also prone to wide infection spread. And to this end, starting from today, we are also restricting the cap on social gatherings for the regions outside the capital areas up to 4. And we are also intensifying and also bolstering our COVID-19 restrictions in these areas as well. And to this end, we ask for your participation fully, and also wear your face mask, and moreover, get tested as soon as possible if you have any clinical symptoms. Moreover, during the summer holidays, we ask you to refrain from going to other regions, and also refrain from having group gatherings and social gatherings as well, and stay home as much as possible.
그럼 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 사전 질문 중에
Right, there was Chong Young with Monday's afternoon briefing, and I have our Kwon Soa back at the desk with me with the gist of what she said. Right, Soa?
Right. We've got almost 36% increase in COVID-19 cases in the past week, and that goes for the capital region as well as the non-capital region. And most of these infections have occurred due to personal contacts as well as among high-use facility cluster infections. And there's been also a rise by variant cases, especially when it comes to the Delta variant. So this is why Chung asked for the nation's people to refrain from traveling over the summer holidays, and also from holding private gatherings.
Right. All right, so thank you very much for that.
Thank you.
최근 휴가철을 맞아 지역 간 이동이 커질 가능성과 국민의 혼선 등을 고려하여 사적 모임 제한을 통일하는 방안을 논의하였습니다.
Given the massive success of the vaccine rollout, given the fact that this is a propitious moment, a good moment to do it.
Social restrictions have been tightened in and around the Greater Seoul area as part of efforts to stem the spread of the fourth wave. But with the Delta variant challenging containment efforts and vaccines in short supply, prospects remain uncertain. For more, I have Professor Yu Byung-uk from Suncheon University. Welcome back, Professor Yu. And I also have Professor Lee Hoon-sang from Yonsei University. It's good to see you again, Professor Lee.
Thank you for having me today.
Professor Yu, social restrictions here in the metropolitan region were raised about a week ago. When can we expect to see the result of these tougher measures?
Well, we are facing on more than over 2,000, but hopefully it will not happen. But we can compare the third wave and this fourth wave, they are a little different because the all over the Korean peninsula is being affected from the COVID-19 spreading. So this is a social distance level is the highest one is from in Seoul metropolitan area. But we show the result in at least 3 to 4 weeks later from now on.
I see. So we need to be patient.
Yes.
Professor, some are calling for the adoption of uniform social restrictions across the nation. What are your thoughts on this?
I think it is a very necessary measure by now because the level of the confirmed case is still in the very high level, and also although majority of the infections are in metropolitan area, we are seeing increasing of the increase of the outbreak transmission and outbreak and the confirmed cases in the non-metropolitan area as well. And besides, we are now dealing with Delta variant, which is composing almost more than 30% of the all the cases, which are much more transmissible than normal variants. So with all these situations, it is quite necessary to have uniform restrictions throughout the country.
Right. And while Korea is seeking to strengthen its strategy against COVID-19, as mentioned earlier, the UK is looking to loosen its lines around the pandemic. Now, in fact, come Monday, all remaining COVID-19 restrictions will be eased in England. For more on the situation there, I have Dr. Shikta Das at University College London live on the line. Pleasure to have you with us again, Dr. Das.
Thank you so much for inviting me. It's a pleasure.
Dr. Das, do tell us a bit about the background behind Prime Minister Boris Johnson's decision to lift all COVID-19 restrictions in England, despite the surge in cases there.
Sure. As you know, there's a significant relaxation of COVID-19 related restrictions from today in England, and masks are not going to be legal requirement in England from today. But government has emphasized that it is recommended that we continue to wear masks in crowded areas such as public transport. Other parts of UK have slightly different rules. Scotland and Wales have continued with masks as legal requirement from now, whereas Northern Ireland will stop it from the 26th of July. The rules may appear a bit confusing at the moment, but the government has also given business and travel operators a choice to decide their own set of rules for face coverings, which might be a good option given the circumstances. And as you know, that the evidence do suggest that transmission mainly happens in closed spaces and shared spaces. Therefore, most scientific bodies and even British Medical Association recommends face covering. Government has issued this guidance based on the fact that wearing a face covering, especially when there's a close contact with people in an enclosed and surrounded spaces, it will help us to reduce the spread of COVID-19. And they have taken this step to ensure that places where there are clinically extremely vulnerable people, they can be protected further. And the emphasis has been given on a good fit of the face mask covering and keeping in with the public health measures of hand washing and social distancing. Most importantly, we are encouraged to now return to work more gradually, and the social distancing guidance is not mandatory anymore. Limits on the number of people meeting has been removed. Larger gathering and events can happen now. Even in terms of travel, guidance have been that the restrictions which we had towards the amber list countries are now removed, except France. And under 18s and fully vaccinated adults do not need to self-isolate upon returning from the amber list countries. And one of the most important changes is from the 16th of August, the bubbles which we observed in schools will end, and the fully vaccinated adults will not need to isolate after contact with a positive case.
Dr. Das, speaking of vaccination, do you suppose the rate of public inoculation there against COVID-19 is high enough to ensure tangible protection against a prolonged pandemic?
Yes, absolutely. So what we observe so far from the data and very encouraging data is that more than 46 million people have had their first vaccines, and which is almost 90% of the adult population, and more than 35 million, which is around 2/3 of adult population, have had both their doses. Now that's great progress, and UK is currently one of the top 10 countries globally in terms of the vaccination rate. The Public Health England also estimated that due to this very good rate, we have prevented 30,000 deaths, has been averted. However, personally, I feel a bit skeptical about predicting this magic number of thresholds of 80 or 85 of the population, which will be fully vaccinated to make us reach this so-called herd immunity or the population immunity. I think the concept of herd immunity for cutting off transmission is surrounded by uncertainties. And the reason we cannot be certain of these herd immunity threshold is because there are too many uncertain factors, such as vaccine hesitancy, new variants, and of course the unvaccinated cohort of children, which act as roadblocks in predicting the magic number thresholds. And I think looking more deeply, I think the vaccine certainly has weakened the link between the infection and death, but it's not completely broken yet. And personally, lifting all the restrictions at this stage of pandemic might be dangerous and premature. I think despite this high vaccination rate in the adult population, there are still several million young vulnerable people who are still exposed. And I think, one thing we always look at is the antibodies. And we do get getting clearer that having antibodies from the vaccination or even natural infection is not going to be enough to stop the virus. And from the data, we very clearly observe that the double jabbed is better than the single jabbed. However, in recent weeks, what we also see from the data is that there is a high risk of infection from the Delta variant even after 2 doses, which is mild, absolutely, but there is still a risk. I think at this stage, we should also worry about infection in the young, causing long-term illness and disability, something what we are calling the long COVID. And we should think about the transmission in high schools, and we still need to consider vaccination in this age group.
Right. And despite the concerns brought up by Dr. Das, Professor Yu, there are some who still liken COVID-19 to the common flu. Can we take this moment for you to remind us about the difference between these two conditions?
Well, fortunately, year 2009, on the crisis in the pandemic of H1N1, fortunately, we have antiviral agents like a Tamiflu at the same time. So Tamiflu is like an oral agent, is easy to access, take it easier, and the people can take it and overcome from the general flu, seasonal flu. At the same time, we have the vaccination. So we have the double weapons, vaccines and easy accessible oral medication. That's why we can easily overcome from the flu. But problem is COVID-19 is RNA virus, so very difficult to expect it to change. So nowadays we have some medicine, but IV injected one is a little difficult to apply to each patient. That's why we need the time to research to defense against COVID-19, same as like seasonal flu. We need more time to go.
Right. And Dr. Das, earlier you mentioned about the presence of young adults who have yet to be vaccinated. What efforts are being made by authorities in the UK to encourage greater vaccination among them?
Sure, I think the vaccine uptake appears to be slightly slowing here in UK. We see a regional variation as well as the latest official vaccination figures from the 4th of July shows that only 57% of 18 to 24 years have had their first dose, and 52% in London, which is quite low. We do see some sort of vaccine hesitancy in young adults, and currently interest in the vaccines have waned a little bit. There's a false perception in young adults that they are not severely affected by the virus. But the government is making lots of changes. Government has made vaccines more accessible. Mobile walk-in clinics has been set. Clear messaging about the safety and risk of vaccine are being provided. More social media campaigns and providing role models to promote the vaccines are being used. And they seems to be making a way with young people. And we are hoping that they will be encouraged to come ahead and take their vaccines.
Right. All right, Dr. Das, as always, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much.
Right, back here in the studio, Professor Lee, how is England's early exit strategy likely to affect global efforts to fight COVID-19?
Actually, I have a little bit of an ambivalent feeling about UK's measure. In one sense, what UK is doing is understandable because we are facing very long-term COVID situations, and the situation will continue. So at one point, we need to transit into a more sustainable way of dealing with this COVID-19 pandemic. Getting back to some level of normalcy, I think there is some level of justification that can be understandable. But the level and speed of the reducing of the restriction in UK is a little bit worrying, especially as Dr. Das said. And for the rest of the world, what we have to remember, especially in countries like Korea, what UK has done is there is some of the conditions. They have enough vaccination rate among the general populations. And also, they are quite, in UK, they have vaccinated quite high proportion of the people in high-risk group, especially people in the age above 65. And in South Korea, even though we have a somewhat high level of vaccination of the first dose of the vaccination for people over 65 years old, but for complete 2-dose vaccinations, we are only about 10% rate. And also, our vaccination rate is only about 30% at this moment. So even though it is catching up very high, still we need much higher level of the vaccination rate among general population to cover that. So while UK is showing some model of how to proceed into the normalcy level of a more sustainable disease control state. But I think if UK is really getting into the state of sending message that now everything is back to the normal and you don't have to wear a mask and you can convene as much as population people as possible, they might send a little bit unsafe message to many of the countries, and that is a little bit worrying.
Right. Meanwhile, Professor Yu, health experts are warning that the Delta variant can also raise the risk of fatality among young people. Could you tell us more about this?
Well, I think this is kind of message to warning to the young people, because young people, they don't care about COVID-19 anymore, some part of young people. But I like to keep on warning about it. COVID-19 can be happening for anyone. Fertility is extremely lower than the aged people and high-risk group. But young people can be damaged because this is very new virus. No one can tell who is safe. So people, please listen. Even young people, COVID-19 can harm anyone, any age.
Right, that's true. And staying with young people, seniors in high school today, Professor Lee, are receiving their shots, their COVID-19 vaccines. Are there any words of caution that you would like to share with them?
So first of all, I think the parents of the high school students do not have to worry about vaccinations because it had been approved by EMA in Europe and FDA in US, and they are all vaccinating their children among age 12 to 15 years old. But just in case, they can be cautionary for basic precautions like chest pain and any kind of discomfort in the chest that shows signs of myocarditis and the symptoms. So besides that, I think you can have a normal level of precautions even for the high school children.
Right, and they're not supposed to exercise after their vaccines, right?
Sure, no.
Right. All right, Professor Lee, thank you very much for your thoughts. And Professor Yu, thank you very much for being with us today. Right, now do continue to abide by all COVID-19 prevention measures even after inoculation to ensure greater protection against the pandemic. Thank you for watching.